The doctor had advised me that he had dementia. Why I was so upset was because all these tests had been done and he was officially diagnosed, quote unquote, with dementia without actually the family being told about it. Hi, my name is Bhavini. I'm caregiver to my dad, who was diagnosed with dementia in 2014. And from 2014 till 2019, I was a working caregiver. I had an emotional breakdown in the office at that time. And unfortunately, he was not dispassionate, but the doctor wasn't overly compassionate either. But no, nor were there any resources given to me at that time. With diagnosis should come support. And when you support a caregiver and try to help them, you are inadvertently helping the patient and supporting the patient as well, because after they leave the doctor's office, they go home with that patient, and the caregiver is the one who takes care of them and is looking for signs, is going to call 911, is going to make the next appointment. And so it's important to really understand the caregiver's role in all of it. My dad had a cardiologist that he would go to see every 6 months. And that cardiologist was very empathetic and very, very overt with the questions he would ask about how I was doing, how mom was doing. The other support that became really important for my parents in particular was a South Asian specific senior support group, which is called Indus Community Services. That support system, emotionally, socially, and they just had a really good ratio of staff to client patient. And that was probably the greatest sense of comfort, because he was surrounded by people who kept him engaged, who got to know him as a person. It's really important to point that caregiver in the right direction. Today, and hopefully for a long time, we have Ontario Caregiver Organization. So their resources, maybe reminding them to use their employee assistance program if they have one. If they don't have one, recommending that the caregiver make an appointment with their family doctor. The family physician, can put in a referral to a community health network, to CAMH, to any sort of service provider that offers mental health clinics, counseling, therapy. But for a family physician to just ask a caregiver, how are you doing? How have things been going? Again, just being seen, being acknowledged, being validated as a caregiver is a first step into supporting a caregiver